Hey y'all, I went over your heart exam and I figured that this might be an easier way to explain to you how you should get the answer to some of the codes. Now, you should be able to see my screen with the exam and the correct answers. I will try to cover up the code and answers to give you some time to look over it and see where maybe you made your mistakes. So I would suggest before I get started to go ahead and get your ICD-10 book and your CPT book. I'm going to start off with the CPT codes first and then end with the ICD-10 codes. I have also posted on Classroom my explanation written out. So if you like to print that and follow along, or if you like to take your own notes, that is really up to you. But I actually have time to sit and make this video for you. Cameron is somewhere around here with his dad. But again, I hope that this helps, and I hope that I'm able to continue with this for the duration of my maternity leave, thus assisting you getting through your certification exam. So let's get started. The first couple of questions, as you know, are vocabulary. So if you did not go over the vocabulary, you did not do well on this section. Cardio is heart. Echo is sound. Phlebo is vein. Angio is vessel or blood. Corono is coronary. Leuco is white. Athero is plaque or fatty substance. And aorto is aorta. Emia, blood condition. Hemato, blood. And here we come up on our first coding question, and this is a CPT question. Daniel Corley, a new patient, and comes to the office complaining of sharp intermittent chest pain that subsides when the patient is leaning forward or sitting up. Chest films show acute pulmonary edema with acute pericardial effusion. The physician performs a pericardiocentesis. What is the CPT code? Now, instantly you should know that when we are looking at this question, CPT is, everybody should have said procedure, and in this case, the patient had a pericardiocentesis, which I do believe I gave you the definition, and if I didn't, pericardiocentesis is where a long needle is taken to aspirate, remove the fluid from around the heart. So if you like to write that down. And this question may have been a little confusing because it does say new patient, and you may have gone to your E&M codes. There aren't any E&M codes, so I can see how that may have been a little confusing. So what you should have done is go to pericardiocentesis, and because the procedure is the first time he is a new patient, it is initial, therefore giving you the code 33010. The next one, I'll let you look it up. I'll give you some time instead of me giving you the answer. That is number 11. I'm going to skip to number 13. Robert Talley has had difficulty getting his breath, and at times he feels his heart is beating very fast. He also finds that he gets exhausted walking up and down stairs. His cardiologist scheduled him for a pacemaker implantation. He has had the surgery A single lead pacemaker is implanted with a ventricular lead. What is the CPT code? Now with this one, you have to be well versed with your vocabulary, meaning that you need to know your synonyms. So implanted is the same thing as insertion. So when you go to look up pacemaker, it's going to tell you insertion. Insertion and implantation are the same thing. So with that being said, I'll give you a few minutes to look up that code, and I'm going to take my glasses off because there's a glare, and I know you can't see my lovely tired face from being up with a newborn. So go ahead and look that code up, and I'll give you a few moments. Or better yet, how about you just pause me, and then when you get the answer, I will explain it to you. So you should have gone to code set 33206 to 33208, and the correct code would be 33207. Now we're going to go to number 14. Michael Oliver is a 46-year-old male that has an SAECG with the ECG, interpretation and report only, due to a diagnosis of unsustained ventricular tachycardia. What is the CPT code? Now this one, I did give you a little information during your practice questions. So you had to know what SAECG meant in order to code this, because you would be absolutely confused and have no idea where to go. With that being said, you should also know that you are looking for a procedure, not a diagnosis. And it tells you right here, diagnosis of unsustained ventricular tachycardia. You are not looking for the diagnosis in this question. You are looking for a procedure. So with the SAECG with ECG, I'm looking at my notes. All you had to do was just look up that code, which I will give you time, or pause me, and then I'll go through your explanation. So your code should be 93278 with a modifier of 26. The reason why you have a modifier of 26 is not self-explanatory, but the reason why you have a modifier of 26 is because right here it says interpretation and report only. Modifier 26 is a professional component. The only individual that could do that is someone that is licensed to do so, such as a physician, a nurse practitioner, that can actually interpret the results for an ECG for a patient. And also, it's the only one that has a modifier, so if you had a choice between a multiple choice exam, which you did, I would pick the one that has the modifier. And why is this coming up in the middle of me recording? Alright, and the last CPT code question is number 16. Excision with application of a patch graft for an aneurysm, femoral artery. What is the CPT code? Now, this one was a little difficult because what you had to understand, and just ignore the answer, okay? Let me hide that because you shouldn't see that right now. When you read this, it really doesn't give you a whole lot of information. You kind of have to play context clues or use your context clues to figure this out. With this one, excision with application of a patch graft for an aneurysm. What are you doing? This question you had to think outside of the box. What is being done to the aneurysm? And for those of you who do not know what an aneurysm is, an aneurysm is a swelling of an artery that can occur in several places in the body. This one happens to be an abdominal aneurysm where you see the normal aorta. And here, this is where the artery is swollen because there's a blockage. It can happen in the aorta, which is the main artery, main blood source of your body. If this bursts, you automatically die. Sorry to be so morbid, but it's the truth. It also can happen in the brain, which you can see there are aneurysms here, and if these are not caught immediately, again, you can die. And the one that you are investigating as far as coding is the common femoral artery, hence the name femoral. So it's going through the femur or near the femur. This is the common femoral artery, and this individual has an aneurysm. Now, what I want you to understand on this question is, again, what is it asking you? What happened? You had to go to aneurysm repair, or that's where you should go in order to look up this question. So I will give you a few moments to look that up. Pause me, and I'll come back and give you the explanation. Maybe I'll sit this way. Yeah. All right. So you should have gone to aneurysm repair, and within the aneurysm repair, it should be the location is the common femoral artery. The code set that you should have looked up is 35141 through 35142. The difference between the codes is 35141 is aneurysm. 35142 is a ruptured aneurysm. A ruptured aneurysm is not the answer that they're looking for. That's not what they're asking you for. They're asking you for an aneurysm. Now, if it was a ruptured aneurysm, then yes, it would have to say that. But since it does not, don't assume that it's ruptured. Don't assume that it has broken open. It is just a regular aneurysm, which is the swelling of the artery that I showed you in the prior slide. So now I'm going to go back to the Icd-10 codes and go through those. Daniel Corley, a new patient, and comes to the office complaining of sharp intermittent chest pain that subsides when patient is leaning forward or sitting up. Chest films show acute pulmonary edema and acute pericardial effusion. The physician performs a pericardiocentesis. What is the Icd-10 codes? In this, you do have two diagnoses, which I'm looking directly at them, and you should be able to name them out loud. So give yourselves together. Diagnosis 1 is what? And the second diagnosis is, you all should have responded with acute pulmonary edema and acute pericardial effusion. Now, these weren't too hard to find, but you did have to read. You did have to read. So I'm going to give you a few minutes to look those two codes up if you don't feel that you need to. Just let your classmates who do need to look them up do so. And you may pause me at this time. All right. So with pulmonary edema, you had to make sure that you looked up acute, because if you do not, you will get the incorrect answer. So you should have gone, there are several ways that you could have looked this up, but this is the main way that I found was easiest. Or I should say there are two ways. Pulmonary to edema, lung, and you should have gotten J81.0. And pericardial effusion acute, you went to effusion, pericardium, pericardial non-inflammatory. But again, remember you need acute. You need acute pericarditis acute, and the code is I-30.9. Okay. Right, so that's number 12, and there are your answer choices. And let's go to number 15. Michael Oliver is a 46-year-old male with the SAECG with ECG interpretation and report only due to a diagnosis of unsustained ventricular tachycardia. What is the ICD-10 code? What is the actual condition that we're looking for here? Unsustained ventricular tachycardia. Now, this one, I will admit, in the ICD-10 book, it's actually unfair. So I won't ask you to look this up. It's tricky because the index, when you go, well, actually, don't look it up to, like, I'm not going to have you pause. But I do want you to look at what I'm referring to. If you go to ventricular, if you go to tachycardia, ventricular, in the index, it says sustained. On the question, it says unsustained. But in the tabular list, the condition is listed as ventricular tachycardia. The reason why I point that out to you, it is very imperative, very important, that when you look up your codes, to not depend on the index. The index said one thing, but the tabular list is your go-to. It is what you depend on, and it's how you code. If you look at the other answer choices, they will not fit and they don't match. So I-47.2 is the best answer. It is the correct answer. It is the only answer. But again, that is why I point out to you that when you look at this, when you look at the index versus the tabular list, it is important for you to do so, because if not, you'll get confused, you'll get frustrated, and we don't want that when it comes time to the test. Okay, and the last one is 17. Yeah, the last one is 17. Excision with application of patch graft for aneurysm, common femoral artery. What is the ICD-10 code? Well, we know that we are dealing with what? The condition is an aneurysm. And you can look this one up. So pause me at this time. This particular question is listed under aneurysm because that is your condition. And the only thing that may have thrown you off or should have given you problems is if you were looking for common femoral artery, it's just under femoral. Because if you look above, it says common iliac. Don't let that throw you. This is why it's important that you know those landmarks as far as your anatomy is concerned, because if you know the femoral artery is in your near your femur, then the common shouldn't throw you off. It shouldn't lead you astray. So that is your explanation for your heart exam. Your actual certification exam is scheduled for May 19th, tentatively. We do have the room available for testing. I'm currently waiting on a proctor to confirm if he or she can assist us with that date. But as of right now, you should be looking forward to May 19th. I have not forgotten about the test review that I gave you regarding some things that you need to know for the review. I will try my best to do another video on that. Your exam for, I believe, the respiratory and digestive system will be on Friday. I will look to see how many questions it is to determine which test you will take, or if you will take both on the same day. So please look forward to that. And I plan to, again, continue doing these videos to assist you throughout the rest of the course. Cameron is sleeping a little bit better, so we might be able to get somewhere with this. As always, if you have any questions, please email me, text me, and I will get back to you as soon as I can. I miss you guys. I love you guys. And stay out of trouble, okay?